Hello viewers, welcome to my channel. I'm Swati, trainee social worker of Sri Shabresha College. Today I'm here to discuss about the topic specific techniques in stress management and anger management. The main content of this presentation includes anger, stress, post-traumatic stress disorder, and grief counseling. So, let's begin. First of all, what is stress? Stress is a feeling of emotional or physical tension. Stress can be defined as a state of worry or mental tension caused by a difficult situation. Everyone experiences stress to some degree. So, how to manage our stress? Stress management offers a range of ways to help you better deal with stress and difficulty, also called adversity in your life. Managing stress can help you lead a more balanced and healthier life. So, there are some kind of techniques in stress management. Let's see what are they. First one is try to eliminate stressors. So, whether or not experience an intolerable level of psychological stress depends on the intensity of the situations and also the person experiencing it. It how you perceive and thinking about. As stressors can also make a big impact on how you respond. It is not always possible to escape a stressful situations or avoid a problem, but you can try to reduce the stress you are feeling. So the other one is cultivate social support. Strong social support can improve resilience to stress. Giving support can also decreases emotions. And the other one is reframe your thinking. One of the most research support treatment for stress and anxiety is cognitive behavioral therapy or CBT. At the root of this therapy approach is the understanding that our thought influence our emotions in turn influence our behavior. And the other one is protect your sleep. You know, sleep is very important factor in our life. So daytime stress affects balance nighttime sleep. And the last one is meditate. A strong and the last one is meditate. A strong body of research shows that mindful meditations can reduce psychological stress and anxiety. Even short-term mindfulness meditations programs also work. And moving to the next topic, anger. What is anger? Anger is an emotion characterized by antagonism towards someone or something you feel has deliberately done or you're wrong. And there are some kind of specific techniques in anger management. First one is consider the value of physical activity like regular exercise as a way to both improve your mood and releases tensions and anger. And the second one is avoid using recreational drugs and drinking too much alcohol, which can make you less able to handle situations. And learning to assert yourself, experience your feelings calmly and directly without becoming defendants, hostiles, or emotional charged. Although expressing anger is better than keeping it in mind. There is right way to do it. Try to express your feelings clearly and calmly. And the next topic is PSTD. What is PSTD? Post traumatic stress disorder. So, PSTD, a type of anxiety disorder, can happen after a threatening or scary event. Even if you were not directly involved, the shock of what happened. So, people with PSTD can have insomnia, flashbacks, low self-esteem, and lot of painful or unpleasant emotions. PSTD close relative to anxiety disorders, and many respond well to anti-anxiety meditations, as well as counseling designed to relieve anxiety symptoms. So, what is a counselor role in PTSD treatment? A counselor helps individuals select an appropriate treatment that will help them recover from trauma. There are multiple types of treatment that counselors can use to help their patients. Let's see what are the techniques. So first one is cognitive behavioral therapy, the short form of CBT. In this treatment, therapists work with individuals to help them understand and change negative thought patterns and behaviors that are causing distress. CBT for PST typically involves techniques such as cognitive restructuring, exposure therapy, and relaxation techniques to help individuals to cope with traumatic memories and reduce symptoms such as flashbacks, nightmares. CBT it aims to empower individuals to regain control over their thoughts and reactions to traumatic events. And the second one is exposure therapy. Exposure therapy. It involves gradually exposing individuals to traumatic memories, situations, or stimuli that trigger their PSTD symptoms in a safe and controlled environment. The goal of exposure therapy is reducing the intensity of their emotional and physical reactions over time. The therapy can be conducted in various ways, such as revisiting their traumatic event in their minds or virtual reality exposure. Throughout repeated exposure, individuals learn to comfort and cope with their traumatic memories and leading to a decreases in PST symptoms such as flashbacks, nightmares, and avoidance behaviors, etc. So it is important to note that exposure therapy should be conducted under the guidance of the trained therapist to ensure safety and effectiveness. So the other one is reality therapy treatment. It involves systematically exposing individuals to the traumatic memories or situations that trigger the symptoms in a safe, controlled environment. The reality treatment also similar to exposure therapy. And the other one is eye movement desensitization and reprocessing. The short form is EMDR. EMDR it is used to treat various mental health issues, particularly trauma related disorders. It involves a structural protocol where the therapist guides the client toward recalling distressing memories, often through side to side movements, although there other form of stimulations like tapping or auditory cues can also used. EMDR helps to facilitate the brain's natural healing process, enabling the individual to integrate the traumatic memories into their overall life experience in a less distressing manner. And moving to the next topic, grief counseling. So, what is grief? Grief is a natural reaction to loss. Grief is both a universal and a personal experiences. Individual experiences of grief vary and are influenced by the nature of the loss. So, what is grief counseling? Grief counseling is a type of professional therapy designed to help you work through the various stages and ranges of emotions you may feel after a loss. So, there are some kind of techniques in grief counseling. The first one is CBT, cognitive behavioral therapy. The cognitive behavioral therapy helps individuals to understand and challenge unhelpful thoughts and beliefs related to their grief, such as feelings of guilt, self blame, or hopelessness. And the other one is acceptance and commitment therapy, short form ACT. ACT is another valuable approach in grief counseling, focusing on acceptance of difficult emotions and commitments to living a meaningful life despite them. Some of the counseling techniques used in ACT is mindfulness, acceptance, value classification, committed action, cognitive diffusions, self-compassion, etc. So the other one is traumatic grief therapy. short form TGT. TGT is a specialized form of grief counseling designed to address the unique challenges faced by the individuals who have experienced traumatic loss. In traumatic grief therapy, interventions may include psychoeducation, safety and stabilization, trauma processing, grief processing, and coping skill development. And the last one in complicated grief therapy. The complicated grief therapy, it refers to a therapeutic approach that addresses complex issues related to gripping behavior such as emotional, psychological factors influencing in one's ability to grasp or hold on to things. And the last one is interpersonal therapy. Interpersonal therapy focuses on exploring the relationship and interactions that may contribute to gripping behaviors or issues with the holding on to things in one's life. Interpersonal therapy aims to help individuals develop healthier connections and reduce the need for gripping behavior as a coping mechanism. So, with some total of discussions, today we are traveled with anger, anger techniques, and stress management techniques, and PSTD management techniques, and grief counseling, their management techniques, etc. are discussed. Hope you all listeners will understand about this topic. So be so happy that when other people look at you, they become happy too. So thank you.